Welcome to Washington Hospital Today, the program dedicated to sharing timely information about the community hospital that's been taking care of Washington Township Healthcare District residents since it opened in 1958. Washington Hospital Today is provided for the sole purpose of informing residents about healthcare topics and issues that have been covered during community forums, free health and wellness classes, or as part of educational sessions held during the district's open board meetings. This program is one more way that Washington Hospital helps empower you, the residents of the district, by providing information needed to make informed decisions about your health.
Today's presenter is Vida Reed. Vida graduated from George Mason University in 1995. She has worked for many years as a research nurse in the area of women's health, heart disease, and diabetes. She became a certified diabetes educator in 2001. She is a member of the American Association of Diabetes Educators and the American Diabetes Association. Vida has been at Washington Hospital since 2006, serving as our diabetes program coordinator.
So the objectives tonight is to define diabetes and prediabetes, identify your risk factors for diabetes, and I want you to identify one strategy to delay or prevent the development of diabetes in yourself or a family member. The percent of adults who have diabetes is increasing throughout the years. The slides that are side by side, the one on the left-hand side is reflecting the obesity increasing in the U.S. And this slide is showing how diabetes has increased over the years throughout the United States. As you can see, as the slide darkens, that means there's an increased percentage of diabetes that's occurring throughout the United States. So this slide goes up to 2015, and then at the end we'll talk about what that looks like right now here in 2015. So as you can see, as the obesity increased in the U.S., so did diabetes. They're kind of going hand in hand as they go across the slide there. So it's important to understand that this is a real serious problem. It's a big deal. Lots of people are getting diabetes, and the big thing is that they're suffering from complications that are associated with having diabetes. So here you can see that side-by-side comparison of diabetes and obesity and how they have both kind of increased together. The number of people who've been diagnosed with diabetes since 1958 to 2015, the percentage with diabetes and the numbers with diabetes, you can see how over the years it's increased. It's just gone up, 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 and up. And now over 20 million people have this disease called diabetes. It's an epidemic, right? There we go. 29.1 million people have this condition called type 2 diabetes. That's about 1 out of every 11 persons. 1 out of 4 people who have diabetes don't know they have it. So there's some people walking around who have full-blown diabetes, but they don't know that they have it. Another 86 million people have prediabetes, the condition that we're going to talk about tonight. And 9 out of 10 of those don't know they have prediabetes. So we're going to do a screening test later, and we're going to see where you guys stand with that. So what does that look like? 1 out of 3 people have diabetes. So out of these 33 people, 1/3 of them have prediabetes. Many of them don't know they have it. This is another way of looking at it in terms of the U.S. population of diabetes. So over here we have the rest of the world, and over here we have 11.3% of the people with diabetes, and 35% of them have prediabetes, according to the New England Journal of Medicine. And then this is talking about the kinds of diabetes. There are 2 main types of diabetes. There's type 2 and type 1. Type 2 we're going to talk about tonight. Prediabetes puts you at risk for getting type 2 diabetes, not type 1. But that's kind of what it looks like in the U.S. Most of the people who have diabetes have type 2 diabetes. There are a few other people who have other kinds of diabetes. You ever heard of gestational diabetes or diabetes during pregnancy? People have diabetes during their pregnancies, and it goes away when the baby is born, but both the mother and the baby of that pregnancy are at risk for developing diabetes. They have a very high risk for developing diabetes in their future. And then there are a few people who develop diabetes, about 1%, as a result of some other serious condition that's treated, and maybe it damages their pancreas or something as a result of like cancer or chemo or something like that. So that's how that looks. Right now, I'm going to insert a video that I can tell you what diabetes is, but sometimes we're visual learners.
Diabetes is a common condition that affects all kinds of people all over the world. It prevents your body from making enough insulin and using it properly. What's insulin? Well, insulin is a hormone your body needs to change food into energy. This is very important because your body needs energy to work well. Your body is made up of many different organs, and they do many different things. One of these organs is called the pancreas, which is where your body makes insulin. When you eat something, your digestive system breaks the food down so it can move through your blood and into your cells. Carbohydrates, or starches, are broken down into glucose, a type of sugar. Your cells use glucose as fuel. Insulin moves glucose out of your blood and into your cells. That's so your body can create enough energy to get you through the day.
So what happens when you have diabetes is that there's a dysfunction in this organ called the pancreas. The pancreas sits behind the stomach in front of the liver. It's kind of buried in there with a little bit sticking out. When you have diabetes, that's the organ that you have a problem with. We call it an organ, but it's really a gland. So in type 2 diabetes, which is the one we're talking about tonight, there's a dysfunction in this gland. What happens is that it doesn't produce the hormone insulin to process your food. So when you eat food, your blood sugar levels naturally and normally rise because the food is converted into glucose in your system. This glucose enters the bloodstream, and the entering of the glucose into the bloodstream triggers the pancreas, this organ, to produce insulin. And insulin's job is to open up the cells of your body to allow the glucose to enter the cell where it's used for energy. And all of the cells of the body require glucose for energy. Similar to your car requiring gas for energy, all of the cells of the body require glucose for energy. So when you have diabetes, the biggest problem you have is this organ. It doesn't produce enough insulin to process your food or to move the food, the glucose, into the cells for energy. So that's what happens with diabetes. It's a progressive illness. In time, this organ produces less and less insulin, so you require more and more help to manage it. Oftentimes when you have pre-diabetes, we look at lifestyle modifications to treat this condition. But over time, if it's not managed well, it will worsen faster and you'll develop diabetes sooner. So the types of diabetes I've kind of already mentioned. There's type 1 diabetes, which is a bit of a different disease. It also is a dysfunction of the pancreas, but it's an autoimmune disease. If you're familiar with things like rheumatoid arthritis or lupus, the body recognizes a tissue or an organ as a foreign object, goes in to fix it, and it ends up killing off that organ and rendering it unable to do the job that it's to do. So in type 1 diabetes, the organ called the pancreas is wiped out completely. It's sudden. It happens very quickly. It oftentimes happens in children, but it can also happen in adults. We used to call it juvenile diabetes, but now we call it type 1. It corresponds to type 2 in that they both have a dysfunction of insulin, but in type 1, you don't make any insulin at all, and you require insulin to live. In type 2 diabetes, which is the most common type of diabetes, it's a progressive loss of your pancreas's ability to make insulin. So you lose the ability to make insulin over time, and it's treated very differently. You may treat it with diet and exercise, you may treat it with medication, insulin, and other kinds of injectables to treat this condition. But what we do know is that it has to be treated and managed so that it doesn't worsen and cause complications in other areas of your body. So where did this term diabetes come from? It's an interesting word because people always say diabetes. You know, it sounds kind of negative, right? Well, actually, the word diabetes is a Greek word. It means to pass through or to siphon. Around 250 BC, the doctors of that time didn't have a name for this condition. But what they noticed is that the people who had this condition that wasn't called diabetes yet, they had a wasting away of fluid. The fluid was just leaving their bodies very quickly. And so that's why they came up with the word diabetes, because it means to siphon or to pull away or to pull out of. So diabetes means the loss of fluid, really. So that's how the word came to be known. They added the word mellitus, which is a Latin word which means sweet, to the word diabetes mellitus. So that's the technical name for diabetes, is diabetes mellitus. We often just say diabetes. Around the 16th century, they identified this disease, diabetes mellitus, as a serious condition. So what is prediabetes? How does that affect us, and why is it important for you to know about that? Well, if you have prediabetes, it means you might get type 2 diabetes sooner in your future, much sooner in your future. You're also more likely to develop heart disease or have a stroke, so it's important to know your risk. When you have prediabetes, your blood glucose levels have started to rise, so your pancreas is starting to malfunction, your blood glucose levels are starting to rise, but the numbers are not quite yet high enough to define it as diabetes. You can have prediabetes and not know you have it. It is a serious condition, and you want to be healthier and delay or prevent the development of type 2 diabetes. And what are some of the things that contribute to you developing diabetes? These are some of the things that put you more at risk for developing diabetes, and we'll talk a little bit about these things. Your genes, stress, obesity, lack of exercise, healthy diet, smoking. The more of those things that you suffer from, the more likely you are to develop diabetes. So when we talk about preventing diabetes, those are some of the things that we'll talk about. How do we manage those things? Obviously, there are some of those things that we can't manage very well. But to stop diabetes, you want to know your risk. What's my risk? What is the likelihood that I'm going to develop diabetes? You want to recognize the symptoms of diabetes. What are the symptoms of diabetes? Do I have it? You want to get early screening and testing, particularly if you have high risk or you're having some symptoms. Most importantly, you want to reduce your risk. Reduce your risk from developing type 2 diabetes. That's the aim here, is to slow down this progression of type 2 diabetes development. So what are the risk factors? Risk factors include things like family history, genes. You know, be nice if our parents left us something other than bad genes, right? Genes, a parent, brother, or sister, a blood relative who has diabetes puts you more at risk for developing it. The reasons are complicated and not fully understood why this is so, and a specific gene has not been identified. But the numbers are pretty striking, especially in terms of people of color. African Americans, Hispanics, Latinos, Native Americans, Asian American, and Pacific Islanders have a higher risk for developing diabetes than other folks. If you had that condition called gestational diabetes, which is the diabetes during pregnancy, if you have high blood pressure or have high cholesterol, if you need to lose a little weight, if you have a sedentary lifestyle, and age over 45. All of those things put you at risk for developing diabetes. Now, clearly, some of these things we have no control over. We can't control aging, because the opposite of aging is dying. So we're going to get older, right? we all got to get out of here somehow, huh? So we can't control who our families are. We can't control our genes. We can't control our ethnicity. But there are some things here that we can manage, and that's what we want to focus on. We want to focus on the things that we can manage and identify steps that we can take to improve our risk for developing diabetes by looking at those things. And this is another slide that I wanted to show you guys that looks at the rates of development in diabetes in people of color. And Fremont is a very rich, diverse community, and a lot of people live here who have a high risk for developing diabetes. So this is an important message to share with you. It's an important message to share with your families and, you know, at holidays and things like that about why they might be at risk for developing diabetes. I meet a lot of people who have diabetes, and most of the time they had no idea that they would get it, and they got diagnosed completely by surprise when the doctor told them that they had it. So it's important to know your risk. Knowing your risk is understanding some of the symptoms of diabetes. These are some of the common symptoms of diabetes when it's undiagnosed or uncontrolled. When the blood sugars are elevated and uncontrolled, a person might experience frequent urination, frequent thirst, and frequent hunger. Actually, those are the top 3 things that people might experience, followed very closely by blurred vision, as that's what people tell me. But frequent urination, frequent thirst, and frequent hunger are the 3 classic symptoms of undiagnosed or poorly controlled diabetes. When your blood sugars are elevated, your body is trying to make a correction. And so what it's doing, remember how they defined diabetes in the beginning, that name diabetes and what it means? To pull away, the fluid is leaving your body. So the body is trying to push this sugar out through the urination. And because of that, it increases your level of thirst. You're thirsty because you're getting dehydrated. In addition to that, you're hungry because your stomach is full, but your cells are kind of still hungry, right? So you feel hungry all the time. And a lot of times people can have unexplained weight loss when they have diabetes. So these are some of the symptoms of diabetes when it's uncontrolled. So it's really important to recognize if you're having those symptoms that you want to think about getting screened. If you have diabetes, and I suppose that there are people here tonight who may have diabetes, if you have diabetes, this is not how you want to manage your diabetes by, well, I'm having more thirst, I'm having more urination, my diabetes is uncontrolled. There's lots of other ways that you can manage your diabetes that are more efficient and effective in having good control. So what about screening? How do you know you have diabetes? How do we define it? Well, we diagnose you through a number of different ways that diabetes is diagnosed. There are several ways we diagnose. That's used a lot now is the A1C. It's used a lot because it doesn't require you to be fasting when you have that test done. It's a 3-month average of your blood sugar levels. And an A1C of 6.5 or higher is considered a diagnosis of diabetes. But pre-diabetes occurs when your A1C is between 5.7 and 6.4%. The other way they diagnose diabetes is through a fasting blood sugar test. That's a lab test that you get drawn out of your arm at the laboratory, not a finger stick that you do with a blood sugar meter, of 126 or higher on at least 2 occasions. And then, of course, pre-diabetes is a fasting blood sugar of 100 to 125. The other ways of diagnosing diabetes include a random test and a 2-hour oral glucose tolerance test. The random test is a blood sugar of 200, meaning you may or may not be fasting, but you may be exhibiting some of those symptoms that we talked about along with that elevated blood sugar. So that's how we diagnose diabetes. And if you have Medicare, they do cover annual screening for diabetes because, as you know, as you get older, your risk for developing diabetes increases, and it's important to them that you screen for it so that they can start to treat you sooner rather than later. So what about testing? I wanted to talk a little bit about testing. Early testing, they observed the excessive passing of urine. They also noted that ants were more attracted to the urine of those people who had diabetes. So this is how they diagnosed it in time of old. They had water tasters, people who tasted the urine. The urine and the blood of those people was sweeter. So they had tasters who did that kind of thing. So I think you guys would probably much prefer this kind of testing, right? than that kind of testing. So, in the early 1800s, they had the first chemical test to indicate and measure the presence of sugar in the urine. So those are some very interesting ways to diagnose diabetes, I think. So what must you do to reduce your risk for developing diabetes? What must you do? Well, you want to move more. That's important, to move more. And I didn't say exercise. I said move more. Because movement can be a lot of different things. It doesn't necessarily have to be exercise. You want to eat well. Eat healthy, you want to rest. And I said just eat because sometimes people don't eat enough. They don't eat enough food. And that can be a risk factor for developing health conditions. You want to rest, reduce your stress, and reduce your weight. So we're going to talk about those things individually. Movement. Regular physical activity every day. You want to do something every day. You want to move every day. The Diabetes Prevention Program studies show that 30 minutes a day of moderate physical activity, along with a 5 to 10% weight loss, produced a 58% reduction in diabetes. That's over half. That's pretty significant, I think, right? So what is moderate activity? Everybody wants to know. Anything that gets your heart rate up to 50 to 60% higher than its rate when you're at rest. And that will vary from person to person. So there's no one answer for that. And there are ways that you can identify your resting heart rate and compare it to your rate when you're exercising. So some examples of moderate activity include walking 2 miles in 30 minutes, not right out the gate. You might walk 2 miles in an hour initially. It's building up to this to get to that moderate activity level. Biking about 5 miles in 30 minutes. Doing water aerobics, because a lot of people can't walk or run and those kinds of things. They may have bad knees or bad backs, but getting in the water, it takes the pressure off of those joints and those limbs, so you're able to do things in the water. Jumping rope, walking stairs, all of those kinds of things are examples of moderate activity. What about rest and sleep? Sleep and rest, they are essential to your ability to learn and to process memories, sleep and rest. And as we get older, there's all kinds of things that are interfering with our abilities to do that, the process of aging, right? So you want to make sure that you're getting a lot of rest and sleep because it's really important to your ability to learn new things and to process memories. Sleep and rest also helps to restore your body's energy, repair muscle tissue, and triggers the release of hormones that affect growth and appetite. So when you're not getting enough rest, it might trigger you to eat more than you normally would eat. The amount of sleep is important along with the quality of sleep. They're both very important things. So how much sleep do you need? Actually, the older you get, the less sleep you need. Adults need about 7 to 8 hours a day. Quality matters too. And for quality sleep, you need about 2 hours of REM. And REM stands for rapid eye movement. It is the most restorative cycle of sleep. So you need about 2 hours of REM in terms of quality of sleep. Some people suffer from conditions that don't allow them to sleep, sleep apnea. If you snore, you might have sleep apnea. So you can always get one of those sleep studies done. If you don't think you're getting enough sleep, if you wake up and you don't feel rested, you might want to have that discussion with your doctor about having a sleep study done to see if you have sleep apnea, because it also puts you at risk for complications. Some tips for a good night's sleep: avoid stimulants in the evening like coffee, exercise, those kinds of things. Stimulants in the evening. Set a wake and sleep schedule and try to stick to it 7 days a week. Set a wake and sleep schedule. Keep your thermostat cool but comfortable between about 60 to 70 degrees. Your body temperature drops during the night when you're sleeping. Try not to watch TV or do work in bed. Reserve the bed simply for your sleep time, right? If you do those things, try to stop about 1 hour before it's time to go to bed so that you can prepare yourself for bed. And if you work out closer in the evening, you want to try to move it up a little bit so that you're not working out so close to bedtime, because exercise is a stimulant too. It will help you rest at night, but if you do it right before you go to bed, it could cause you to feel more energetic and not to get enough sleep. And one of the things I've noticed with my patients, especially after they retire, they get in a habit of staying up late at night, watching TV or reading books or playing games on the computer. And it kind of really your clock starts to reset on that. And if you don't pay attention, before you know it, you're up all night and then you're sleeping all day and your body gets really rewired for that. But the health risks that you have increase when that happens. Even if you sleep all day, the health risks associated with being awake at night are still increasing. What about stress? There are no specific guidelines for how much relaxation a person should incorporate into their lifestyle. But making time to unwind and enjoy life is an important part of maintaining good health. When you have stress reduction, when you reduce your stress through resting, you release the body's feel-good hormones, those hormones that make you feel good, serotonin, prolactin, and oxytocin, and they lower the stress hormone called cortisol. The stress hormone called cortisol is a real culprit in the development of diabetes. So you want to make sure that you're having some stress reduction. One example they gave was petting a dog for 15 minutes or something similar, hugging a kid. I think it helped. When I hug my granddaughter, I always feel so good when I hug her. So I think it's probably releasing those good hormones for me when I do that. Some of the things you can do to reduce your stress and to relax include massage. Human touch releases serotonin and reduces the blood pressure and heart rate, making you more relaxed. A nice massage or a simple hug may help put you at ease. Here at the hospital, we have a massage therapist that you can go and see here. We have a lot of services here. Other stress reduction activities include things like yoga, meditation, and worshiping with your religious or faith group are important things to stress reduction. And the next thing we're going to talk about is weight loss, because when you're well rested and you're getting some activity, you know your risk. Now, what about this weight loss of 5 to 10%? What does that look like to us? Well, this is a nice little scale. It kind of tells you what that 5 to 10% would look like for you, depending upon how much you weigh. 8 to 15 pounds, if you're 150 pounds, is what's considered 5 to 10%. And remember, we said that with 30 minutes of moderate activity, along with 5 to 10% weight loss, cut your diabetes risk in half. So these are some pretty concrete numbers that you can start to focus on if weight loss is something that you need to work on or you want to work on. Without weight loss and moderate physical activity, 15 to 30% of the people with prediabetes will develop diabetes within 5 years. So without doing those things, your risk for developing diabetes increases over the next 5 years. So it's important to consider those things. Some weight loss strategies, and I'm not going to be really specific about things because we're really talking about prediabetes, and some of the things you may need to help you accomplish this may be to see another professional one-on-one to try to get some strategies that are specific to you. So weight loss strategies include things like cutting back on calories and fat, and if you don't know what foods have fat, you could benefit from maybe seeing a nutritionist. Be active most days of the week, that 30 minutes of moderate physical activity. Eat breakfast daily. That's an important meal to have. I reviewed some data on a registry called the Weight Loss Registry, and they talked about the success rate of people who have lost weight and kept it off for a period of time. And they had some things in common. And one of the things that they had in common is that they all ate breakfast. They all ate breakfast. They've lost a significant amount of weight, and you can Google the Weight Loss Registry and go check it out. You can also keep records of what you're eating and drinking. Sometimes what happens is that we're not always sure what we ate. You know, when people come to see us and we say, well, how much do you eat? And they'll say, this much, you know, they're not always really sure. And when you're keeping records, you might want to start out with measuring cups to really have an idea of how much food does your favorite bowl hold. You know, how much does it hold? So you might want to get a measuring cup and really measure what goes into that bowl so that you can have a better idea of what you're putting into your body and make some different decisions if you have to. Implement a weight loss program. Another thing that the Weight Loss Registry folks had in common is that they implemented some kind of weight loss program, whether it was something on their own or through something that was more organized like Weight Watchers or Jenny Craig, or they saw a nutritionist, but all of them did something to change their diets. So that's something you want to consider about. So a combination of meal planning, physical activity is the most successful way to accomplish these goals. In summary, you want to learn what you must learn, do what you can do, and remember to smile and grow where you're planted. So you guys got the Type 2 diabetes risk test in front of you. Everybody see that test? This is a really good test. It's a good predictor of your risk for diabetes. And I take this to all of the family gatherings. I do Thanksgiving at my house, and everybody has to take the risk test every year. You know, and I've seen people's risk increase. When their waist increase, their wrist increase, right? So we're going to do the first question here. It asks how old you are, because we know as you get older, your risk for diabetes increases. So you see you get more points for age, right? So you want to give yourself the corresponding points to your age. So I'm going to do it too, right? I'm going to do my risk test up here as well. So I've got 2 points there, because I'm between 50 and 59. So I got 2 points. Now, unfortunately, we didn't talk about this risk factor, but being a man increases your risk for getting diabetes too. But being a man, you get a point. You get 0 points for women. I'm going to give myself 0 points there. But the next question is for us ladies. If you're a woman and you have been diagnosed with diabetes in the past, you get 1 point. But what if you didn't get diagnosed and you had a big baby weighing more than 9 pounds? If you had a baby that size, I'd give yourself a point for that. I get 0 points for that one. Do you have a mother, brother diagnosed with diabetes? So I'm going to get a point for that because, like I said, both of my parents had diabetes. I've got siblings who've got diabetes, so I probably should get a double point for that one. Have you ever been diagnosed with high blood pressure? Anybody been diagnosed with high blood pressure? Take blood pressure medicine. You know, don't take it, but you've been diagnosed with high blood pressure. You get a point for that. I'm going to get a 0. Are you physically active? Physically active. Now, be truthful with yourselves, right? Changing the remote is not exercise, okay? I just recently started back to exercising. It had kind of fallen off a little bit, and it's been a struggle. My accountability partners called me today to check on me. Well, she texted me today to check on me. So I'm getting, I'm trying to stay on top of it. I'm working on it. But until I really have it down, I'm going to give myself a point there. Okay, what is your weight category? So over here, you're going to find your height. You're going to find the column where your weight fits in and follow it to the bottom and give yourself the points that are required for that. I'm just going to be honest and give you guys my points. I really am. I'm going to get 2 points there. And then once you do that, you're going to tally your points. Okay, so increased risk for developing diabetes is a score of 5 or higher. This test has been vetted in research. It's evidence-based. They've done research with this test, and it's pretty accurate in terms of predicting who's going to get diabetes, right? So if you got a 5 or higher, your risk for getting diabetes is high. Over the next 5 years, if you don't do the moderate activity for 30 minutes, lose 5 to 10% of your weight if you need to. Some people don't need to lose weight. If you need to, your risk for diabetes is going to increase, right? Was it 30% they said? But if you have a 5 or higher and you implement the exercise and you implement the weight loss, your risk for diabetes is going to be cut in half. Does that seem like a good deal? It's a good deal, right? I think it's a pretty good deal. So that's what I'm working on, because my risk for diabetes is increasing because I got a 6 and I'm getting older all the time and I just got to stay on top of it. I'm working on it. I'm really, really working on it, right? So what I want you to do is to think about something, a very specific thing that you want to do to improve. What result do you want to get? Why don't I pick one person who wants to work on something, and we can do your goal together, and then you guys can follow along with your goal. So somebody want to come up and do their goal with me, and we can use it as an example for everybody else? Okay, so what specific thing is it that you want to work on?
Weight loss.
Okay, so she wants to lose weight. Is that your goal?
Yes.
Her goal is to lose weight. Now, is that very specific?
Okay.
Okay, she said no. I think she's right. It's not very specific. She wants to lose weight, right? That's the target, is to lose weight, right? But we got to get a little bit more specific with that question, because how do you plan to lose weight?
I need to change my diet.
Okay, she wants to change her diet. So that's how she wants to lose weight. She wants to do it through diet, right? So with your diet, how do you plan to change your diet to lose weight? Excuse me.
I need to stop snacking on all of the bad things. I need to give up ice cream, cookies, cake, candy.
Yeah, okay. Actually, that's very good. She said she wants to stop snacking. That's a good target for her diet. She wants to stop snacking. That's very specific. She said what her snacking was, right? Ice cream, cookies, cakes, and pies. She wants to give up that stuff. She wants to stop snacking. Now, what about potato chips? Are you snacking on potato chips?
And not pies, cake.
Cake. Oh, she likes cakes. She likes cakes.
Yes.
What about potato chips and that other stuff? You eat that too?
Chips, yeah. Cheetos,
Is that included in your
Puffs.
snacking?
Oh, yeah.
Okay, snacking. So she wants to stop snacking, right? So she wants to stop snacking because ultimately she wants to lose weight, right? Okay, so when do you snack now?
Okay, so my husband gets home at 1 o'clock in the morning from work.
1 a.m.
And he brings me snacks.
He really loves her, huh? Well, I was married before, too. My husband would bring me a Mr. Goodbar, especially when he'd been naughty. Because he knew I liked him. I don't like him anymore. So 1 a.m. snacking. Do you snack at other times during the day?
During the day, you know what? I don't eat well. I skip meals.
But we're going to focus on snacking now. One thing at a time.
Okay.
Because you don't want to overwhelm yourself with your goals, right?
Okay. That's mainly my sabotage.
It's the 1 a.m.
Yeah, because I wake up in the middle of the night when he's coming in, and usually I'm up a little while, so I'm hungry again.
So you want to stop snacking. Are you going to stop snacking cold turkey? Or are you going to maybe do snacking maybe once a week or twice a week? Or what do you want to do here?
I want to implicate good snacks where I don't feel guilty.
So you want to get up at night at 1 and have carrots? I'm just checking, I'm just checking.
Have you heard of bring carrots?
So that's
Maybe
that's
change
going
the
to be part.
hours.
That's probably going to be okay, yeah, because that's going to be part of your challenge. Is the 1 o'clock in the morning is not a natural time for eating, right? So you want to give up snacking at 1 in the morning. You might want to just give that up and then just move the snack, a healthier snack, to another time, maybe closer to after dinner or something.
Okay.
Is that something you want to do?
Yeah.
Have a healthy snack after dinner. Sometimes snacking is a result of hunger too. You're not getting enough to eat in a previous meal, so you might snack a little bit more. So you want to definitely think about that. Are you getting adequate, nutrient at your meals?
No.
Maybe not. So your meals become a combination of snacks. You just snack throughout the day kind of thing. That can happen. But we want to focus on this 1 a.m. snack at night.
Okay.
So you've decided you're going to give that up, but you're going to have a snack maybe closer to dinner time,
Okay.
and a healthier choice of a snack, right? Okay, so that's the goal. That's easy to measure. We can measure that. So what do you need to be strong in this? What kind of skills do you need to give up that snack? What are you going to say to your husband? Let's role play.
Okay.
I'm your husband.
I'll text him.
Honey, here's your snack.
I don't think I should have that. Maybe there's some.
Are you okay?
Yeah, I'm okay.
Did I do something?
No, I just really don't think I should eat that. Maybe if you brought me some fruit.
Some
instead.
fruit.
Some fruit.
What kind of fruit you want, baby?
I like watermelon.
Watermelon, okay. I'll get you a watermelon then. Okay, he's gonna bring her a watermelon, right? Okay, 1 in the morning. Okay, so because you got to have that conversation with him. You got to bring him in. I think part of it too is you want to tell him why it's important, why you're making this change, and why it's important to you, and you need his help. You got to get him to buy into it and be your support, but not your police, right?
Yeah.
Nobody wants to be the diet police, right? And so you want to get his support and tell him why it's important to you and tell him how you can help. And you can tell him that I'm probably going to be struggling sometime, but you got to make me stay strong.
Okay.
You got to do that. So that's some of the things you got to do is you got to work with your husband to talk about this change you're going to make, because it's going to create a change for him too. And sometimes we give food as love. Food is love, right? It's not unusual. So you're going to give up, specifically you're going to stop snacking at 1 in the morning.
Exactly.
You're going to talk to your husband about it and help him to choose a healthier snack, and maybe have a snack closer to dinner. So we have a very specific goal. How can she measure that goal? How's it measured? It's measured by how many times does she snack, right? So you can measure it. You know when you're snacking, right?
Yeah.
So you got to keep track of it. How often am I snacking? Because sometimes the success is not in completely fixing something. Sometimes success is that I do it less, and you build on that. So that's why I say maybe you're not going to say you're going to give it up completely, but move it to another place, right? And it's an achievable goal. It's an achievable goal because you can give up snacking. When we think about goal setting and whether or not they're achievable, and it's like, for example, I want to go to the moon. Well, you can go to the moon. People have gone, they've gone to the moon and they're still going. There are people there now. But am I going to go to the moon? You know what I mean? Is that really an achievable goal for me? It probably isn't right now, because I got to go become an astronaut first. And I think I'm too late for that. So that's why goals have to be things that are achievable. For example, if you want to start exercising, you say, well, I'm going to run a marathon. Well, I haven't even started walking yet, right? So I might want to start with walking. Yes, I can run a marathon. It's something I could do, but is it achievable for me where I'm at right now? So you got to make sure your goals are something you could do. And you don't want to set yourself up for failure either by setting a goal that's too high, And sometimes that's self-sabotage. We set them high, because we know we can't do it, and then we don't always consciously do that, but that can happen unconsciously. We sabotage ourselves with setting goals that are too lofty, right? So, and it's a relevant goal because we know that changing your diet, less snacking is going to help you lose weight and be healthier, right? So that's good. So when do you plan to start?
Tonight at 1 a.m.
Tonight at 1 a.m. Tonight at 1 a.m. she plans to start. Okay, good. And so you got to reassess this goal every week and see where you're at. And so in terms of achievability, you might say, well, 80% of the time, I want to make sure I'm not snacking. And maybe 20% of the time, yes, because you're going from 100, right? So maybe 20% of the time you're still snacking, and kind of measure your success in that way. Not that you never snacked at all, and that's a success. Sometimes the success ends us reducing it.
Okay.
All right, well, thank you so much.
Thank you.
Thank you very much. So you guys have all got to set a goal, something that you can do, something that you want to do, something that's important to you so that you can reduce your risk of developing diabetes. And most importantly, share this information. Share it with your family members, share it with your friends, share it with your coworkers. Just share this information because it's such important information about diabetes. We bury our heads in the sand a whole lot about this disease, and it's devastating to people who don't have it managed,
That concludes our program. Thank you very much.
Thank you all so much.